Hi, everybody. This is Lee, and I'm talking about John Conyers' bill, the H.R. 676, the Expanded and Improved Medicare for All Act, which is now the new hotness in North America. That the word is getting out. People are learning more about it and saying, like, hey, this is something that's definitely an improvement, a step up from both the Affordable Care Act and the Affordable Health Care Act, that it actually answers a lot of issues, provides a lot of comprehensive information, answers a lot of concerns. And that reading the text of the bill is very detailed. It's not too complex, even though it is legislation, that the reading of it is pretty accessible at the high school level or first year college level. You can definitely read it and get an understanding of what's offered, what's on the table with HR 676, the benefit of it, how it improves lives, how it actually saves lives. That currently 45,000 people die per year because they do not have access to affordable quality health care. And that's just something very detrimental to a nation that considers itself, as Representative Steve King of Iowa claims, that we are civilized. That 45,000 people in a civilized nation die because they cannot afford to buy healthcare treatment is not a positive reflection on our nation. And so there's an opportunity to turn that around, to make ourselves a leader in how to treat citizens of a nation. People worry about how to pay for this system. Some people claim that we don't have the budget for it, but we actually do have the budget for it. It's just that our budget is going to our military and also international aid. In fact, that our budget is being used for overseas endeavors. Our budget is being used to destroy nations and then also to rebuild nations, and that we are supplying international aid to countries who have universal single payer health care. In fact, we are using our budget that would otherwise go towards our own health care to subsidize the health care and the citizens of other nations. And that makes no sense at all. And so, anyway, besides our current budget, there are many other ways to finance Medicare for All. And I've gone through it a couple of times. I'm going to go through it again and then refer people again, once again, to the actual bill itself, because that is explained very clearly on how it's paid. And so the following progressive financing plan would meet the specifications of HR 676. This is Gerald Friedman's write-up that he did in 2013. And so I'll post a link to this in the description. I found it at healthoverprofits.org. Physicians for a National Health Care Policy also have information, but I'm going to read this off. And so the following progressive financing plan would meet the specifications of HR 676. Existing sources of federal revenues for health care, and that includes Medicaid, also Medicare as it exists now for 65 and older. Other sources of government-funded health care would be folded into this Medicare for All program, since everyone would be included. So that existing revenue that's set aside now would be put into this program to cover everyone. A tax of 0.5% on stock trades and 0.01% tax per year to maturity on transactions and bonds, swaps, and trades. And so this would be a transaction tax on corporate transactions. And so that will also be included in the budget. 6% high income surtax, which applies to households with incomes of greater than 200,000, $225,000. And then a 6% tax on unearned income from capital gains, dividends, interest, profits, and rents. In addition, a 6% payroll tax on the top 60% of income earners, and that would apply to incomes of over $53,000, the tax paid by employers. And then a 3% payroll tax on the bottom 40% of income earners, which applies to incomes under $53,000, the tax paid by employers. And so basically everyone would be paying into the system, some with the progressive tax based on income, others with Wall Street transactions, others with unearned income, and then money folded in from other programs. And so this is how the Gerald Freeman claims that HR 676 would be funded. And so there's also at this website a comparison of National Improved Medicare for All versus the Affordable Care Act versus American Health Care Act in terms of universal coverage, full range of benefits, cost savings and sustainability, choice of healthcare professional and hospital, portability, progressive financing. And then getting back to the choice of healthcare professional and hospital, that yes, all healthcare professionals and facilities in the United States are included in the network. And so you would not lose coverage by going outside the network. And it's also portable, that all are covered no matter where they are in the United States. And so, again, this health over profits explains the reasons to support HR 676. That it's universal, that it's simple, it gets rid of all the bureaucracy involved with insurance verification. Everyone is in, no one is out, everyone is eligible. And that you don't have to hire people to do the coding, the billing. You're not paying for the overhead and administration and the operations cost of these healthcare exchange systems. That it's simplified, it's sleek, and that cuts out a lot of the financing. It's comprehensive. HR 676 lists in detail what is considered medically necessary coverage. Also, how it's paid for, how it's applied, things like this. Even the fact that eventually the Indian Healthcare Service would be reviewed to see if that might be included, and that even Veteran Affairs will be reviewed by Congress. So many details. And that it saves money, it's financed up front through taxes, that it ends rationing based on ability to pay. Again, that people won't die from the lack of ability to pay for necessary treatments, prescription drugs, surgical procedures. That the days of people waiting and hoping and fundraising on GoFundMe and asking around for help with medical expenses, even liquidating assets like homes and cars and taking out mortgages, that comes to an end. And that it ends medical bankruptcy. It gives the most choice, again, in terms of network and portability. And then it gives the most freedom, and that HR 676 is good for business. So many reasons to support it. There's also ways in which this website busts myths and does fact checking and myth busting on the concept of single payer universal health care, and then specifically this Medicare for All bill, this act. And so, again, I'm very happy that word is spreading and that more people are signing on in the House, that it looks like it's up to about 93 co-sponsors. that certain members of the House are paying attention to their constituents, and that more people are finding out and realizing, despite the gaslighting from people such as Jason Chavez, who seem to imply that if you buy an iPhone, well, you don't get health care, and how ridiculous and sick and disgusting that attitude is towards citizens of the United States, that we deserve better than what we've been getting, that we deserve the right to live healthy and happy lives, and that we should be taking care of ourselves before we take care of any nation overseas, and that the days of people dying from lack of access to quality health care have to come to an end. People are tired of the gaslighting, and it looks like our House members are realizing that. And that, in fact, some people can consider this a litmus test, and perhaps it is. The litmus test being that, do you feel your constituents have a right to health care? Yes or no? And we shall see what the response is to that. If the answer is no, then what will the constituents, how will they respond to that supposition? But I think it's looking really good. Hopefully, as more people sign on, that HR 676 will come out of committee and actually make it to the House floor for a vote. And hopefully, there'll be a corresponding bill in the Senate, a Medicare for all bill, not a public option, not a Medicare for some, 55 and older, Medicare for all, single payer, universal health care. We're definitely deserving of it, and I say good luck.